The highly contagious disease known as measles was considered eradicated from the U.S. 25 years ago. That was thanks to a highly effective vaccine and high vaccination rates. But due to declining immunization rates over the last several years, we're seeing a resurgence of measles. Outbreaks in Texas, New Mexico, and just across the border in Ontario have infected hundreds of people. 2 of them, including an unvaccinated child, have died. We talk about how that worries local public health officials and what they're doing to prepare for if measles hits the North Country on today's Story of the Day.
Support for Story of the Day comes from Claxton Hepburn Medical Center, dedicated to providing patient care and regional services to the people of St. Lawrence County. claxtonhepburn.org.
Hi, I'm Kara Chapman, and for David Summerstein, it's Thursday, March 20th. Up first, it's officially spring in the North Country. The snow and ice are melting, flowers are popping out of the ground, and the birds are back. This season brings a lot of change to the natural world around us. Emily Russell takes us on a spring walk in the Adirondack woods.
I'm out here walking at the Brewster Peninsula trails, which are in Lake Placid. It's a bluebird day, really sunny out, warm in town, but then you go into the woods and you realize, oh yeah, it's still wintry and there's still lots of snow, especially in the woods. But it's just beautiful out here and so nice to soak up all this sunshine here and just see the woods changing as it warms up. I feel like I'm in this little cloud of chickadees. They're way up in the tops of the trees above me, but they're also right along the snow below me. One just flew over my head so close I could hear its wings flapping. And I'm standing in a little ray of sun. It's beautiful. So I'm walking alongside a brook now that empties out from Lake Placid, and it's definitely full from the spring snowmelt that's happening right now. I can now see it right through the trees. You can definitely hear it. It's beautiful. So the sun is shining on it. It's turned the brook a kind of like sea green color in the sunshine as it churns up all the air and the bubbles, and it's really a lovely spring green color. I'm just coming out of the trees now. Oh, wow. This is cool. Oh, my gosh. So I'm walking out to the edge of Lake Placid, and it's almost entirely frozen over still. But where it empties out into this brook, it's obviously opened up. And I don't know, the where the ice meets the open water is creating this beautiful like curvature in the ice. These lovely artistic patterns here. And then I'm just looking at the mountains beyond, and I can see Whiteface right now. Beautiful. Emily Russell, North Country Public Radio, at the Brewster Peninsula Trails in Lake Placid.
Measles outbreaks in Texas, New Mexico, and Ontario have infected hundreds of people. 4 cases have been confirmed in New York State, 3 in New York City and 1 on Long Island, and a child in Vermont recently tested positive after traveling with family out of the country. Local health officials are worried measles may hit the North Country. I spoke with Erin Streif from St. Lawrence County Public Health, who says her agency is concerned about rapid spread in vulnerable populations. She told me the disease is highly contagious.
It's airborne, which means the virus can remain suspended in the air for a couple hours after an ill individual has been in that location. The R-naught, which is an epidemiological term that describes how many people one infected individual can potentially spread an illness to, is estimated to be 12 to 18 for measles, which is among the highest known. So for comparison's sake, the common cold or seasonal flu is estimated to be 1 or 2. Our supervising public health nurse has taken a very proactive approach for this reason, with updating our internal staff as well as community providers on what to look for and how to quickly diagnose it so we can reduce the spread as much as possible.
What does it look like when someone has the disease, when they're infected with measles?
Measles is characterized by a rash. I think that's what most people kind of envision when they hear measles, but it can actually be spread before the rash even appears. So that's when an individual is experiencing the earlier symptoms, and those are, there's this helpful alliteration for them. It's cough, coryza, and conjunctivitis. So cough, obviously. Coryza means runny nose, and then conjunctivitis is referring to red, watery eyes. And there's also typically a pretty high fever, up to 104 Fahrenheit with measles. That said, it can develop into pneumonia, which is a lung infection, encephalitis, which is brain swelling, and it can cause preterm delivery in pregnant women. So it can be very serious. The estimated death rate with measles is about 1 in 1,000. So we're actually seeing a higher death rate than that with what we are understanding to be reported in the country right now. My understanding as of this morning is we have maybe 326 confirmed cases with 2 people who have sadly died from this disease.
Right. Very sad. What do we know about, the protection among the St. Lawrence County community? What are the vaccination rates, and how does that compare to what's needed for herd immunity?
New York State data uses the New York State Immunization Information System, or NICIS, to help us understand county vaccination rates. NICIS has only been around since 2008, though, so that doesn't capture much of the adult population in the state because only children's immunizations are required to be reported. It's optional for adults. Based on the NICIS data, only about 76% of children receive 1 dose of MMR, so that's measles, mumps, and rubella vaccine, before age 2. The vaccine schedule for measles is to receive a dose at a child's first birthday, and then a second dose just before they start school, so at age 4 or 5. It's possible that our vaccination rates are in fact higher than that 76% that's reflected in the NICIS data, but it still indicates that up to 25% of our kids may be vulnerable, which is certainly too high. Ideally, we would want to see about 95% of the population vaccinated in order to attain that herd immunity that effectively eradicates the disease and it protects those who have a medical or some other contraindication to receiving the vaccine.
And, when we look at the spread happening specifically in West Texas right now, it's been concentrated in a Mennonite community there. There's generally lower vaccination rates. It's been reported they're not specifically anti-vaccine. They just kind of tend to prefer natural remedies to addressing health concerns. And we have a similar kind of rural community here with the Amish. So what do you know about how they approach vaccines? And are there any special public health concerns about their vulnerability to outbreaks of diseases like measles?
Similarly, there is variation in vaccine uptake by sect, so it depends on the stance of the bishop and other mitigating factors. There's not a definitive answer, but we are concerned for our Amish neighbors, and we do consider them to be at increased risk. We have reached out to a few individuals in the community who work with the Amish community in various ways, just to remind them what to look for and to reach out to us to help coordinate any testing that might need to happen.
Measles is on a long list of vaccine-preventable diseases. In Texas, there have been hundreds of cases. We just talked about how a couple people have died. What's it like to be a public health professional, in this moment?
In this moment, there's variability in vaccine acceptance, perception. There's not a universal thought that vaccines are what people are interested in obtaining. But while no vaccine is perfect, the vaccine is the most effective form of protection from becoming seriously ill and spreading measles to others. If you're an individual who's not sure about your vaccination status, your healthcare provider can help you determine if you're immune, and that could involve blood work or titers to check for antibodies to measles. If you know that you or your child has not received the vaccine, we ask that you reach out to your healthcare provider or call us about getting vaccinated.
That was Erin Streif from St. Lawrence County Public Health. We spoke about measles. We have more news all the time on our website, ncpr.org. Music today by Eddie Lawrence of Saranac Lake and Dogface of Winooski. I'm Kara Chapman, North Country Public Radio.